What is up, Dong Army? It's your boy Royce. I'm gonna be doing an unboxing. Oh wait, what? I'm gonna be doing a reaction to my surgery clerkship grade. I'm really eager to figure out what my grades are because grades are the most important part to medical school. You know, more so than exercise and relationships and work-life balance and happiness. So, you know, as a medical student YouTuber, I am extremely humble and extremely secure, which is why I don't need any sort of external affirmation for my accomplishments. I'm sharing with you my grades now, not for my benefit, so you can tell me how smart I am, but as a way for you to learn somehow, hopefully. So yeah, this is definitely not for me. It is 100% just for you guys, my audience. And I want you guys to know that some of the results here have been released for like a few weeks now. And you know, I have crazy self-control. I have not seen these scores before. You'll be getting my 100% unadulterated, genuine reaction to them. And definitely these are not photoshopped at all, just to boost my ego. Again, it's nothing to do with me. It's all about you guys. So this is technically my first grade in medical school so far. And that's because the first year and a half of medical school has been just preclinical courses that are pass-fail. And the thing is, even if you do fail, you just have to do some remediation and that'll get changed to a pass with no markings on my transcript. That's a really great thing for me because I ended up failing my team exam for the pulmonary unit. And that video is available on YouTube. It'll pop up in the corner. I feel just so much gratitude that I was able to learn from my mistakes in the past without any sort of consequences, and that I was able to monetize it for views. So at Penn, for these clinical clerkships, they compile all of your scores into one final grade for that clerkship. So for surgery, I can get either honors, high pass, pass, or fail. I'm honestly not really sure how grades play a role in matching for residency, but you know, I'm trying to match to ophthalmology, which is an extremely competitive specialty. You know, that's surgery, so I'm trying to do well in the surgery thing. I'm still, you know, forced to continue pursuing ophthalmology because I made a YouTube video on it. That's like a binding agreement right there. So without further ado, I'm gonna grab my trusty iPad that I only use sometimes nowadays, and I'm gonna pull up my surgery grades. So the surgery clerkship grade consists of a few things. So one thing is the shelf exam. At Penn, that is an NBME standardized test. It's pretty difficult and it requires a lot of studying through things like UWorld. Another component obviously is your different rotations. We also have an OSCE. I'm not really sure what OSCE stands for, to be honest with you, but it's basically just like standardized patient stuff where you know, go into a room and you work with a standardized patient as if it's the first time you're seeing someone. Another thing was PBL, problem-based learning. That was basically just like a small group covering, you know, like breast cancer. Another week's covering thyroid stuff. It was actually very helpful for the shelf exam. So the first thing I'm gonna do is do the OSCE grade, which is the standardized patient stuff. So as you can see on my screen, this was released via email over a month ago. And you know, it says unread there, so clearly I've never seen this before, even though it's been out for over a month. But yeah, here we go. I'm really excited to see what my score is. So dear Royce, this report in your clerkship, OSCE, blah, blah, blah. Your final score, 0.80 or honors. So that's really exciting. Wow, yeah, that's really exciting. Checklist score, case A, case B, case C. Okay, it doesn't mean anything to me, but whatever. Again, this is the first time I've ever seen this because, you know, the email is unread and there's no way for me to open an email and then make it unread all of a sudden. That just is not how technology works, you know? So looking at the bottom here, I guess I can see the breakdown, subjective, objective, differential diagnosis, and the last column is diagnosis and treatment plan. But this is a big confidence booster. So the next thing will be my shelf exam score. So even though it was released like a month and a half ago, I haven't seen this before because obviously the email says it's unread. And why would I lie in a YouTube video for views? Hello attaches your shelf exam score report. Scores are pass/fail for this clerkship year. If you get a 63 or higher, you pass. And if you get a 62 or lower, you fail. So let's open up this document. Here's the document. It's released from NBME. Just a bunch of text here, I guess. The mean and standard deviation were 74 and 9 respectively. That's like kind of high, I feel like. Again, we're just second years, so this is like our first clinical experience ever. I'm not really sure what I'm looking at here. There's just oh, here we go. It shows the breakdown per topic, which again is not very meaningful to me. So, oh, in the top right corner, it says total equated percent correct score is 81. So 81, wow, let's go, that's awesome. The cutoff again was 63, safely passed the shelf. I'm really glad my performance enhancing drugs were timed really well for this test. So I guess the last thing is my overall grade report. So this will be exciting. Okay, so here's my grades. What is this even saying? So I guess my first thing is Gen Surge for trauma at Presbyterian Hospital. Yeah, okay. History taking, so it's like the breakdown of scores, I guess. History taking, 6 out of 7, okay. Physical exam, 5 out of 7, okay, not bad, still getting most of the points here. Okay, I'm just gonna skip way ahead. I think this is it. I mean, it's so hard looking at these grades. This is why I never look at my grades, because it's like the hardest thing to do. So for my urology rotation, this is a composite evaluation for Royce Dawson's surgery 200 clerkship rotation in urology. Okay, blah, blah, blah. Overall, he put in an excellent performance during the 2-week urology rotation. Very enthusiastic and personable, willing to help and be a team player, okay. Obviously, I remember the attending who I was under for urology, and he was just such a relaxed and casual guy, so it's funny to see him like kind of talk more formally. And you can just tell based on like typos and stuff that he's just mashing this out in like 30 seconds. Colorectal surgery, very enthusiastic and personable, willing to help and be a team player. Okay, I'll take it, I guess. Okay, so now for trauma, faculty, fellows, and select residents, blah, blah, blah. Great guy to have in the team, looking after patients, good work ethic, great student, work through tough cases, has good judgment. That should only mature with the experience and time. Okay, gotcha. So, surgery clerkship grade, overall honors. Let's go. So let's see what they said here. Royce did an outstanding job on his rotation. Blah, 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 a lot of random stuff. Yeah, so all around honors level work. So I'm guessing this is what the clerkship directors copy and paste and give to like all the students who get honors. But still, it's kind of nice to read this and pretend like it's personalized for me. So yeah, this is a huge confidence booster. Areas for improvement, it's not important. I don't need to read this. My superiority complex will not let me read this. And I guess this is my score breakdown. So for general surgery, I got honors, I guess, so 30. Subspecialty 1, which is urology, I got a 15, which is a max score, so again, honors, I think. Subspecialty 2, colorectal, I got a high pass, 12 out of 15, I think it's a high pass. Shelf exam 10, that's just pass fail. OSCE 15, that's honors. PBL 10, honors. I'm pretty sure the surgery resident who ran my PBL just gave everyone honors. And then professionalism, I'm guessing, is a free 5. So I got a 97, I guess. And I needed a 91% to get honors, so I safely got honors. Wow, that is awesome. Yeah, I think that's basically all I have for this video. Hope you guys found this entertaining and hope you guys enjoyed my super genuine reactions to these scores I've never seen before. I'm really excited to keep posting because I need to help pay for my electricity bill. I program my breaker box to only turn on for 2 hours in a day, so this is actually a really narrow window that I have to record. So hopefully I can, double that to 4 hours soon once I get some more money. Hope you guys enjoyed this video. Hope you guys are staying financially responsible, and I'll see you guys next time.